We can begin. Excellent. So good afternoon, everyone. Thank you so much for joining this session of the information session for letters of interest for the Chicago Air Sensor Network Advisory Board. We are recording this session as well for anyone that was not able to join us live. And my colleague Isabella will place the link in the chat, and we also have a QR code here so that you all can easily access the website where this information is posted online at the Chicago Department of Public Health. The folks that you'll be hearing from today on this information session are myself, and my name is Jess Lynch, she, her pronouns. I'm from the Illinois Public Health Institute. I'm joined by my colleague Isabella Pissarro, she, they pronouns, and she is also from IPHI. And we are also joined by our colleague Grace Adams from the Chicago Department of Public Health, and Grace will be speaking with you shortly. So I'm going to go ahead and share our agenda for today, and then I will pass it over to our colleague Grace. So for today's session, what you will be hearing from us is background and information about the partners for the Chicago Air Sensor Network. And then the bulk of this meeting will be to really go into detail on the call for letters of interest for the advisory board for the Chicago Air Sensor Network. We will give an overview and a timeline. We'll give some more information about the advisory board and the expectations, what the compensation will look like for community-based members that are selected, the qualifications for community-based members of the advisory board, the review and selection process for the letters of interest, how to submit the letter, and then recap the next steps that you can take if you're interested in submitting a letter. And we'll leave plenty of time for questions. If you do have questions, you can put them in the chat as we go. And you can also wait until the end of the presentation and ask your question and unmute. So either of those options are open to you. So one thing I just wanted to highlight for people is that our contacts are at the end of the slides, so you will have contact information for us. And also in the website where Isabella has placed in the chat, there's also contact information available there. So with that, we will move forward with our agenda. And I'm going to pass it over to Grace to give some background on the Chicago Air Sensor Network.
Hi, everyone. Thanks for joining today. I wanted to just kind of provide a brief overview for those of you who are not aware. The Chicago Air Sensor Network is really to expand the community air sensors across the city. So air quality data currently comes from a lot of different sources, and it's not all providing the same information in the same places. And so Chicago recognized the need to kind of put all of this together. And so CDPH and UIC School of Public Health have purchased more than 230 Clarity solar-based, solar-powered air sensors. And so we are working closely with UIC School of Public Health to actually put these around the city. And so as part of this work, we are going to be collecting this information from the sensors and then working with community groups like your own to actually determine some of the placement for the sensors and then how we're actually going to be presenting the data that we actually receive from the sensors, because we want this to be, a collective communicative process where we're all working together and we're making sure that we are addressing the needs of the community. And we are actually going to be trying to educate and learn together throughout this process. So, we can get into more details about that if you have specific questions, but I do want to be mindful of the intent of this meeting today, which is to cover more about the advisory board and the actual involvement that community groups were seeking to have as part of this network. And so if you want to just, yeah. So as part of this process, we are, working closely with IPHI as well. So they're going to be covering more about their role with the advisory board and the Healthy Chicago zones. But just wanted to kind of set the stage a little bit there. So thank you.
Oops. Thank you, Grace. For anyone who has just joined, my colleague Isabella will place the link in the chat here where you can find all of the information online about the current call for letters of interest. Um, and we're going to really dive in now to the information that's contained within that call for letters of interest. Please don't hesitate to put questions in the chat as we go, and we'll also have an opportunity for you to unmute and ask your question at the end of the presentation as well. So um, first, just to give an overview, the call for letters of interest was first put out last Friday and will be open for 2 weeks through Friday, May 9th. So if your organization is interested in submitting for this opportunity, we are asking that those letters be submitted by Friday, May 9th at 11:59 p.m. and you'll be submitting those to Isabella at the email indicated here. The letter of interest, and I will go into this more in a few minutes, is intended to follow a template so that it's as easy as possible to fill out and submit. And we're looking for that to be no more than 2 pages long. And I'll show you more about that in a few minutes. The timeline for the letters of interest is indicated here on the slide, so I'll just walk through this with you all. As I mentioned, the call for letters of interest was released last Friday, April 25th. We're currently holding this information session today, and we have 3 sets of office hours that we have scheduled to answer questions or provide support as folks are putting together their letter of interest. The exact time of those office hours are listed on a later slide and also available at the website in the link that you have in the chat. As I mentioned, the deadline to submit the letter is Friday, May 9th. We will then be working through the week of May 12th to review the applications, and selected organizations will be notified by the end of May. All organizations who submit a letter will be notified one way or the other, and those notifications will be made by the end of May. So just to go into a little bit more information about the advisory board, as Grace mentioned earlier, the Chicago Air Sensor Network is a new collaborative project that is being stood up in the city of Chicago. And this is in response to a widely noted need to have more community air sensors across the community and a partnership between the city, the UIC School of Public Health, and those organizations and partners that will be part of this advisory board. As you can see here, the advisory board will include several different organizations and agencies. So the advisory board will include community-based organizations, the Chicago Department of Public Health, the Chicago Department of Environment and Department of Transportation, the UIC School of Public Health, and other environmental regulatory agencies that relate to air quality, which are listed here. The call for letters of interest is specifically for community-based organizations that would like to be a part of this advisory board. So this call for letters is for the community-based organization seats on the advisory board. The advisory board member expectations are listed here on this slide, and to really just sort of overview those for you all. These are the expectations for the remainder of this calendar year, so May through December of 2025. Um, the advisory board members are expected to attend all board meetings. You do have the ability to send a proxy if the assigned representative is not available for a particular meeting. Advisory board members will also complete some pre-work for different meetings. And the real bulk of the work comes in providing input and feedback on sensor locations, hosting community meetings and trainings to help spread awareness about the new Chicago Air Sensor Network and increase understanding of air quality data across communities, providing input into the creation of an online visualization platform, and collaborating with government agencies, academic institutions, and other environmental justice and community-based organizations on the board. For community-based advisory board members, each of the community-based advisory board members will receive a grant from one of the Healthy Chicago Zone regional lead organizations, and that compensation will be in the amount of $39,858 for the period of May through December of 2025. I will share in a few minutes a little bit more information about the regional lead organizations and the regions and the number of seats that each region will have on the advisory board. In terms of the qualifications for the letters of interest and for serving on the advisory board, the organizations applying to be a community-based advisory board member um, must meet the following qualifications. So the organization must be a 501c3 organization or have an established fiscal relationship with a 501c3 organization. The organization should have at least 5 years of experience in environmental health advocacy or programming, and or the organization's leadership must include people with lived experience and impact of environmental justice issues. The organization must be a community-based organization with a hyperlocal geographic focus for a neighborhood or set of neighborhoods within Chicago. So these are the three qualifications. And as I will discuss in a moment, these are the qualifications upon which we will work to review and select the advisory board members when we review the letters that are received. So as I mentioned earlier, the grants to the community-based advisory board members will be administered through the Healthy Chicago Zone regional lead organizations. And so we wanted to take a few minutes to make sure that people are oriented to the Healthy Chicago zones and the regions that are represented. Um, so the map on the left-hand side is available at the two websites that are listed here. We will place the links in the chat so that folks have easy access, and these links are also included within the call for proposals that you have seen in order to make it to this info session. So there are 6 regions across the city, and based on the air quality index and cumulative impact data that the Chicago Department of Public Health and partners have collected across the city, they have determined how many seats there will be per region based on the concentration of communities that are most impacted by air quality issues across the city. So just to simplify that, those regions and communities that have the highest concentration of communities impacted by air quality issues across the city have a larger number of seats on the advisory board. So the Chicago Department of Public Health wanted to make sure to use the data that is available to make sure that the representation of community-based organizations from across the city would truly represent those communities most affected by air quality across the city. Therefore, you can see in the table here that there will be one board member for the North Central region, one for Northwest, three for the West region, three for Southwest, two for Near South, and three for Far South. As we receive the letters of interest based on the communities and neighborhoods that your organization serves and represents, we will route your letter to one of these regions. Then the Illinois Public Health Institute, our organization, will work collaboratively with the regional lead organizations to review each letter of interest and to support those regional leads in selecting and notifying the advisory board members for each region. The advisory board members will be notified by email with instructions for onboarding. And as I noted in the previous timeline, those notifications will be made by the end of May. I'm just going to pause here because I can't see the chat as I'm presenting, and just check in with Grace and Isabella to see if there are any clarifying questions that have come in through the chat that we should pause to answer now before I continue with the presentation.
I'm not seeing any questions, Jess.
Okay. I would encourage folks, don't hesitate to put questions if you have them. That's what we're here to do, is answer those if you have any questions. Okay, so I am going to dive a little bit deeper into the template for the letter of interest at this point. So I'm going to go ahead and switch screens for the share so that I can show you the template itself. And Isabella, if you wouldn't mind just placing one more time the link to the CDPH website, that way folks know where they can go to download this template. Just a moment, I will be sharing my screen shortly. Okay, so just to orient you to the document that you will download from the CDPH website, the first 3 pages cover the information that I just shared through the presentation. So that includes the advisory board member expectations, the compensation, qualifications, and the process by which you will submit your letter, as well as the links to this information session and the upcoming office hours. On page 4 of this document is where the template for the letter of interest is located. And so IPHI and CDPH and our partners at the UIC School of Public Health have really tried to make this letter of interest process as simple and short as possible. So what you will see here is that there are, in bold, the sections that we're asking you to fill out within this template. So you will be including your organization, the name and title of the person who would serve as the advisory board member, as well as the contact information for that person and for the organization. You will also just summarize the number of years that your organization has worked on environmental health and the area of geographic focus, so the neighborhoods that you focus on within your organization. And then within the letter, I will just highlight the couple items that we are asking you to fill in. So the first section is for you to provide a brief description of how the organization and the board representative would help the advisory board to achieve its goals. So this can be 1 to 2 sentences. We're not looking for anything extensive here. Here you will repeat the information that you have about the neighborhoods that your organization serves and the number of years that you've been working on environmental issues in Chicago. And you can include examples of some of the previous experience that you have. We're also asking you to just provide your initials to indicate that you are um, able to complete the functions and expectations that have been laid out for the advisory board. So you just put your initials there. And then the final piece is we're asking you to, and this is kind of the core of this letter, is 3 short paragraphs about the following 3 items. Why you would like to be involved in the project, your knowledge related to air quality issues in Chicago, and your capacity to complete the expectations of the advisory board member role. So as you can see, we are not looking for you to provide an extensive application. This is a short letter of interest, and we're hoping that the letter will be not more than 2 pages in length. Really just to show how you meet the qualifications that I laid out earlier and your interest and capacity that you bring to the project. Before I move back to the PowerPoint presentation, I will pause to see if there are specific questions about this template, since I have it up on the screen currently. Any questions in the chat, Grace or Isabella?
I'm not seeing any questions in the chat.
Any questions that folks would like to come off mute and ask about this letter of interest template before I move back to the PowerPoint? Happy to take questions now if anyone has them. Okay, hearing none, we'll wrap up the presentation and then we can definitely come back to this if we need to. So I'm going to switch screens again. So apologies in advance if it takes a minute for me to get back to the previous presentation. Isabella, are you seeing the correct screen at this point?
Yes.
Wonderful. Okay, so we just did a deeper dive into the letter of interest template. So just to recap the next steps and the timeline, at this point, we will be looking for all interested organizations to submit their letter of interest by Friday, May 9th. And we will be reviewing those applications the week of May 12th with the regional leads. And selection decisions and notifications will be made by the end of May to everyone that submitted their letters. We do have office hours set up to support organizations that are interested in submitting a letter and have any questions or need any support in putting their letter together. Those office hours will be hosted by myself and Isabella, and they are taking place at the 3 times shown here on the slide. So Thursday, May 1st, Monday, May 5th, and Tuesday, May 6th at the times indicated here. It will be the same, it will be one Zoom link that you can use during any of these time slots. And that Zoom link is in the call for letters online, and we'll also place it here in the chat so that folks have easy access. It's also been in the emails that went out from CDPH. We are looking for questions to be submitted by Tuesday, May 6th. so that we have time to update and compile the FAQs that are online and make sure that there's a complete set of FAQs reflecting all the questions that have come in. So please do submit your questions either through email to Isabella or by coming to the office hours by Tuesday, May 6th. Our contacts are listed here. So you have Isabella and Grace's contact from the website and from the emails that have gone out. You also have my contact here. Questions about the letter of interest process can be submitted to Isabella. We've gotten a couple questions that have already come in, so appreciate folks and your interest and your submission of those questions. And then if you have questions about the broader Chicago Air Sensor Network project, you can also submit those to Grace at CDPH. So with that, we will go ahead and move into the questions. And I see that Mariah has a question. Go ahead.
Hi, thank you so much for this. This was very helpful. Maybe I missed it, but you said the last day to submit questions is May 6th, and then you said a question and answer document will be created. Will that be made published somewhere specifically, or will it just, where will that live?
Yes, thank you. I was not clear on that. So thank you very much for asking that. The question and answer document also lives on the same website. There is a current version of that question and answer document that is there currently that I think it has about 3 questions on it that we already received. So we will be updating that as we receive questions. Can Isabella or Grace just fully confirm for me? I believe it is linked. I think I saw it this morning, but can someone just confirm that is in fact on the website and people can access it now, correct?
Yeah.
Wonderful. We're gonna only give the main link just because both the template and the FAQs kind of link to either Word documents or PDFs and might distract people from the main website. But if you go to that main website link, you'll be able to find the FAQs doc right there. If anyone has any challenges in encountering that, obviously feel free to just reach out directly to Isabella and we can email it to you as well. Yes, Sonia, go ahead.
Hi, thanks so much for the presentation. I have a couple of questions related to the timing. The monthly hours, it said 10 to 20 a month. I was wondering about what you anticipate as far as the flexibility of these hours. And then also, the contract is said to end December 2025. And I'm wondering if there's any sort of plan in place if the deliverables, in particular the data dashboard, doesn't get completed within this time frame. If there's any sort of anticipation that the contract will be, either extended or renewed under different terms, in the event that, that main deliverable isn't met.
Thanks for the question, Sonia. I can get started on that, and then CDPH, I would encourage any one of you to expound upon what I answer. So in brief to your questions, yes, we do expect, we do not expect that it will be 20 hours a month every month. We just wanted to have like kind of an upper parameter for that. We expect it will be more like 10 to 15 hours in most months. In terms of the flexibility, the only commitment that will be and at a specific point in time will be once the group sets its meeting schedule, the expectation will be to attend those meetings, which we expect will probably be occurring roughly on a monthly cadence, but we do know that the group at the advisory board itself will set its meeting schedule. So those dates have not yet been set. So those dates will be like a fixed expectation. In terms of other work, we do expect that most of that other work would be occurring either asynchronously or on a schedule that the member themselves would set. what do I mean by that? I mean that we would have pre-work that would be sent out prior to the meeting, so there would be an expectation that the person would review and potentially provide feedback on that prior to the meeting, but they could do it during whichever hours that they would want to, prior to the meeting occurring. And then the other piece around sort of broader awareness building and educational components to the community that you serve, those would really be based on your own timeline. And I can tell you that we will not be setting a specific expectation to say you have to do XYZ type of event on XYZ date. It will really be based on the knowledge that each advisory board member has about the best ways to get the word out within the communities that they serve, and taking the opportunity to do so within some of the work that you're already doing. So that's the first question you asked, and I will get to the other question about timeline. But does that help to answer your question around the number of hours per month and what that work would look like, Sonia?
Yeah, definitely. That's great.
Okay.
Thank you.
In terms of the timeline, and this is where I'll probably ask CDPH to follow on. The one thing we can say definitively is that this this part of the project is funded out of um, American Recovery Plan Act, ARPA funding. The good thing about that funding source is that the money has, already come to each of the jurisdictions. Um, but we also know that that money has to be spent. And so the city has set an expectation that the money for this project that comes out of that funding source, for this year of the advisory board, needs to be spent during this calendar year. So there will not be an extension for this scope of work and this set of funding. That this will be on the set timeline that it is set to occur. To your question about some components of the broader Chicago Air Sensor Network project that may or may not be completed within this year, for example, the data dashboard, we absolutely have the expectation and know that there will be feedback and input provided on the dashboard this year. Whether or not the dashboard would be actually completed during this calendar year is not a date that is set in stone. But in terms of the deliverables of advisory board members for this year, your expectation will be to provide really formative input into that dashboard. And that will occur during this calendar year. I will ask CDPH if there's anything else you would like to weigh in terms of sort of the questions around the ongoing work of this advisory board beyond this calendar year. Or we can also answer some of that within the FAQs, but I'll pass it over to CDPH if there's anything else you would like to add to what I already said.
I can add one piece, and then if anyone else from CDPH wants to elaborate, please feel free. But just wanted to clarify, so as it currently stands, as just said, the payment for community participation does end in December 2025, but we are actively pursuing additional funding opportunities because this is an ongoing project and there are deliverables that, may need to go beyond this year. So that is something that we are actively pursuing. That is something that, we hope to have as, an opportunity, but there is, the chance that we are hoping the advisory board continues to meet beyond 2025 without promised financial support as we kind of get through some of these pieces toward the end of the year and into the first part of next year. But that is something we are definitely taking under consideration as we make these plans.
Thank you.
Okay, apologies. I just had a technical glitch. Thank you so much for that, Grace, and thank you, Sonia, for those excellent questions. I see we have another hand up. Apologies if I mispronounce your name, Kirti.
Hi, yes, thank you. Another timeline question. Is there a goal timeline for the deployment of the air sensors or when that will begin?
I'm happy to
Yes,
take
go
that
ahead,
one.
Grace. That would be great.
Yeah, so I'll take that one. So right now, as Jess mentioned, we have these two different pieces kind of in moving in motion at the same time. So this discussion right now is about the advisory board. Because the air sensor deployment piece is tied to the feedback that we receive from the advisory board, a lot of this work does need to wait for that. We are in progress on other steps related to the actual deployment, such as the testing, the co-location, etc. So at this point we are looking at a summer timeline for the actual deployment of these sensors. So we are targeting, the July, August timeframe most likely. And, again, that is dependent on, having this feedback come in, having these conversations and making sure that we're all in alignment. But that is what we're currently working toward.
Thanks, Grace. Did that answer the question or any follow-up to that?
Yeah, thank you.
I see that there was a couple questions in the chat, and appreciate Mervin's response in terms of how this ties into the CDPH Healthy Chicago strategic plan. Any other questions from folks on the line today? Yes, go ahead, Sonia.
Sorry, we had a long list of questions. There's just, let me just ask a couple more here. Okay, sorry about that. I guess we wanted to know a little bit more about what the relationships between IPHI, CDPH, and the regional leads look like. You explained a little bit of that in the general presentation. But yeah, how will those different areas of work be communicating?
Did CDPH want to start on that, or would you prefer that I do that?
Oh, feel free to go ahead, Jess. Thanks.
Okay, and feel free to follow on if I miss anything. So I'll start with IPHI since I work here, so I can say the most about that. So IPHI will be what's called the Lead Coordinating Organization, or LCO, which is just a sort of type of contractual relationship that exists between city agencies and delegate agencies. So we will be the lead coordinating organization just for the advisory board piece of this work. And so our role with respect to the advisory board members is to help to facilitate this letter of interest process and help to and support CDPH in onboarding the different partners to the project. Our primary role will really be to actually facilitate the advisory board that, as I mentioned earlier, is made up of the community-based organizations and government agencies, both city departments and regulatory agencies, as well as the UIC School of Public Health. So our primary role as IPHI throughout this year will be to facilitate and support the work of the advisory board. And then the regional leads, which are also ongoing delegate agencies of the city of Chicago, I think as most of y'all are aware, for the Healthy Chicago Zones projects. Those regional leads will primarily be serving in a administrative and regional function within this project. So For the purposes of those of you that are interested in submitting letters of interest, for practical purposes, the regional lead would be the entity that is administering your grant. So they're receiving the funds from the city for the advisory board member grants, and they will be administering those and making sure that you are getting paid and supporting your work. The regional leads will not be members of the advisory board. They will not be, they do not have a required scope in terms of content for this project. So if the regional lead organization is interested in participating in sort of like the community education component around air quality, they would be welcome to do so, but they are not required to do so under their scope. So their scope is really to maintain a relationship with each of the advisory board member organizations and administratively support your grant for the length of this project. CDPH will be working with both IPHI and the regional leads. Their staff and team member support at CDPH will largely be actually focused on the implementation and rollout of actually getting the air sensor network built and online. So CDPH and UIC colleagues will be primarily focused on the implementation of that. IPHI will be helping to facilitate the advisory board, and the regional leads will be administering the grants and holding the relationships with the selected community advisory board members. Does that answer your question, Sonia, or did you have any follow-up?
Definitely. Thank you so much.
And we really do not mind that people have questions. That's why we're holding this session. So do not hold back, any of you, if you have additional questions. Since we have a relatively close-knit group here, we're happy to hear from the same people multiple times. So before we wrap up today, I do want to make sure that everyone got their questions answered. Any additional questions that people have?
Can I add something? I want to clarify just one of my earlier statements, if that is all right. While other folks are kind of considering what questions they have. But regarding the timeline with installation and deployment, I just want to be clear, that timeline, like I said, is we're targeting the summer, but that doesn't mean that the data will actually be readily available at that time. So I just want to be clear that, it will take some time for that data to be collected and for us to ensure that it is, quality data that is working, like the sensors are doing what they're supposed to, and that so there is a phase in there in which we are having the sensors be fully operational before the data is actually available on this publicly available dashboard that the advisory board will provide input on.
Thank you, Grace. One other thing that I will add, and I mentioned, and several of us have mentioned throughout the course of this call, that the UIC School of Public Health is an important partner in this project. I just want to sort of add in what their role is, as in addition to what I just stated earlier about IPHI and CDPH and the regional leads. So one of the really exciting aspects of this project, which I think most folks who are on this call know, but in case for anyone who may be watching this recording later, just to kind of put it on the record, one of the really exciting things about this project is the collaboration and partnership between the city, UIC, and all of the community-based experts and partners that are represented. In the specific case of the School of Public Health, they are bringing air sensors to this project, and CDPH is bringing air sensors to this project. So this is really an exciting opportunity to create a very robust network of community-based air sensors that are being brought to the project by both our public sector colleagues at CDPH and our, I guess, also public sector colleagues, but academic colleagues at the UIC School of Public Health. So the UIC School of Public Health is working very closely with Grace and her colleagues right now on the testing and planning for the actual placement and rollout of the air sensors. And IPHI will also be subcontracting to the UIC School of Public Health to support some of the engagement of Dr. Sarab Erdal and her team to be a part of this project. So Sarab and her team have other funding that is supporting the majority of their implementation work, but they will be a formal partner in this project in terms of the collaboration with the advisory board and the ways in which you all as advisory board members can tap into the technical expertise of Dr. Erdal and the UIC team as the air sensor network is being rolled out. So just wanted to highlight that as well. I see a question here in the chat. Thank you so much, Sonia. Will the data dashboard include multiple networks? There are current projects underway to expand Purple Air Monitor networks around the city. This is one I do not know the answer to myself. So Grace, if you have an answer, feel free to weigh in, or otherwise we can provide an answer in the FAQs.
I think at a very basic level, I mean, that's one of the considerations, Sonia, is we don't have the data dashboard yet, because we haven't made that determination and we're not sure what the platform will be. So there's a lot of like pieces that are still kind of floating out there that we are uncertain about. And like that is where we're looking to, to have guidance and input from the advisory board and the community around some of these decisions. But I look to anyone else from my CDPH colleagues if you have a stronger answer that is a clear yes or no for Sonia. Otherwise, we can get back to you.
Yeah, hi Grace. This is Kirsty. So I'm working with Grace here at CDPH. I'm an epidemiologist, and I would say the answer is, like Grace said, we're not really sure. But the thing that we're doing is that we're using clarity sensors, and so they'll be calibrated and they'll be algorithms we'll use to to provide like the actual like the values for the sensors. And so that's why we're doing the co-location with the federal monitors and stuff like that. So there's sort of like this like adjustment weighting factor that we'll be applying. And because like the Purple Air sensors are not the same as ours and they're not co-located with the FEMs and stuff like that, we won't have the, I just don't know. I'm not saying no, but it may be more difficult because the data, it'd sort of be a little bit like comparing apples to oranges, because we know it's like, we'll be using two different ways to measure things. And so I don't know if that's necessary. And again, I'm not saying that it's for sure, but I don't know if that would be the best thing to do to have them on the same platform. I am not an expert in this, but I think it's just, I think to Grace's point, it's TBD, but again, sort of they're different sensors. And so it's not as like easy to throw them all in. And then you can say, oh, to compare and contrast. So anyways, the answer is sort of, I don't know, but we can provide more clarity. We'll talk with Sarab. She may have some more clarity. And then some of it might be to Grace's point. We may just have to wait until we get more into like what the actual data dashboard is going to look like. So, it depends, what everyone sort of wants to be in there and then what's possible. So that's a great question though. Thank you.
Thanks so much.
Awesome. Thank you so much, Kirsty, for expanding on that. That was very helpful. I see we have one additional question here from Marissa. How will the air monitoring networks be used by organizations? Will they be used for enforcement or violation purposes? Do we have an answer for that, yet.
To some
for the
extent, yes.
17?
Yeah, so I can take this, Jess. So to answer your question regarding enforcement or violation purposes, no, this data will not be used for that because this is a different type of data. So the network itself is really to provide that neighborhood level air quality data to the public in a way that's easy and useful to understand. And so it's more around providing that information and that education. And we can use it as part of our ongoing environmental health surveillance. And we can use it to kind of advise some of these things like permit conditions or inspection assignments. But at an actual enforcement level, it is not something we can do because all violations that CDPH can issue must be based on FRM data, which is Federal Reference Monitor data.
Thanks, Grace. Appreciate everyone's really thoughtful questions. Before we wrap up this session, any last questions that people want to make sure to get in today? Okay, then just to let you all know, as I mentioned, this session is recorded, so the recording will be posted on the same website that we've been sharing the link throughout this presentation. That is also where you can find the letter of interest template and the ongoing FAQs. And we look forward to receiving your letters of interest before or by the May 9th deadline. Please do remember that IPHI will be hosting office hours starting tomorrow. And the dates for those office hours are included on the website. So we encourage anyone who needs any additional support or questions for the formulation of their letter to please join those office hours. We're happy to provide the support that we can. And you can also reach out to Isabella with any questions that you have. And please do submit those questions about the letter of support, the letter of interest, excuse me. Please do submit your questions by Tuesday, May 6th. Thank you everyone for your time today. Is there anything additional from CDPH before we wrap up the call?
No, I
Excellent.
just wanted to say thank you for joining, and thank you to Jess for really facilitating this meeting. Appreciate it.
Wonderful. Well, thank you, everyone. We'll be back in touch over email and via the website, and look forward to receiving your letters.
Thanks, everyone.